as a patient at the cancer center, a full range of services are available, including nutrition support from an oncology dietitian or cancer dietitian, myself. What that means is that throughout the process, from potentially the initial stages of diagnosis through treatment and hopefully well into survivorship, the patient has the opportunity to talk about their nutritional needs, any concerns that they have, and I can help guide them through whatever the most critical issues are at that time to help the patient feel supported or potentially to help the family support the patient while they're going through treatment. The interesting thing from my perspective about cancer and nutrition is that it's very individualized because there are so many different kinds of cancer. How it affects each patient will vary depending on what parts of their body are affected by the cancer, what treatments are being proposed. So that could include some surgery or some chemotherapy or some radiation. With each of those, there are potential issues that can come up. So if you're dealing with a new diagnosis, some of the questions that you have about trying to prepare for surgery or what might happen when you start chemotherapy, we can talk through some of those. So a very common question with a new diagnosis is, well, what can I expect during chemotherapy because I've heard so many stories? And there are some common themes, things like having a low energy or low appetite or feeling a little bit queasy. And we could talk through some simple strategies to try to put into place if those issues start to happen so that you're ready with a game plan. If something does happen, how do you start dealing with it? And then if you notice that symptom, we can talk about that in much more detail when it's actually happening to you. My goal for all of my nutrition patients are to help maintain their strong nutrition status or as strong as possible throughout their treatment. So that will mean that they have more energy, they're able to enjoy more of their life and participate more fully in daily activities and maintain their strength as they're going through treatment and into survivorship and beyond.